So I would like to open this momentous occasion with a moment of silence. In reverence for those we have lost in our struggle, we are reminded by their silence that such suffering still exists in our world today. Let us join together today to begin down a path that will bring an end to such suffering in our communities. We can do this by approving this vital measure, House Bill 8132, an act that would extend protections of the Good Samaritan Law to include the distribution, possession, and utilization of testing supplies to determine the contents of illicit substances before consumption occurs. My name is Michael Galipeau, and I am the president of the Rhode Island Users Union. We are an organization of individuals with lived experiences with substances that have common interests in consumer rights and protections, human rights, human health, and sensible policy. I want to begin by thanking the many members of the coalition effort to address the opioid crisis. I would like to thank the hard work of Representative Erin Reagan Berg and his legislative team for their incredible work in bringing forward this legislation. I would also like to thank Senator Josh Miller for being a constant presence in an ever-changing sea of change, and our legislator, a voice and advocate for those who struggle with mental health and substance use. Of particular note, this effort would not have been possible without the avid support of organizations like Rikers, our state recovery community organization, and Protect Families First. I would also like to thank the collective group of doctors, medical professionals, first responders, and police that have lent their support to this effort, and for their continued support in delivering these services that are part of a statewide strategic effort to mitigate the loss of life from overdose. I am humbled by the support this effort has received from so many people. I am encouraged to live in a world where understanding supersedes our fears and division. It is this very fear, for so many of us who have experienced substance use, that causes for us to become burdened by shame. We suffer in silence, too afraid to speak about what we struggle with for fear of punishment or marginalization. But today we are silent no more. Today we stand united to say, we deserve life too. We have the tools available today to end the death from overdose. This very important step brings us closer to living in a world where such things can become an important lesson in our history. Today we stand together to tell the world, let's start a dialogue. Let's start a dialogue that includes the dignity and humanity of consumers and the ways in which we can keep consumers safe. Methods have been for far too long available in every other industry available to man. As a civilized society, we know what needs to be done to keep people safe. In industry, established methods of manufacture, packaging, labeling, inspection, regulatory oversight, and research have long been tools that have kept our consumers safe. While we have a very long way to go to bring these measures to this sector of our industry, testing is a critical and vital measure to promote consumer safety and to promote market responsibility. This is the first very important step towards a world where consumer activities are genuinely afforded the same protections as every other industry on this planet. What an astounding time to be alive in this country. As we increase consumer education and access to tools to increase market responsibility, we empower our consumers to have conversations about their struggles. We strengthen our community's ability to protect itself from crimes of opportunity. No sensible person can argue that a distributor who would seek to kill another person by introducing a toxic substance is engaging in criminal behavior. However, this argument as a theory for murder is strengthened when consumers are adequately empowered to make informed decisions about their consumption. A person who tests a product, identifies the presence of fentanyl, and proceeds to use that product with the certainty of its contents cannot displace responsibility onto their distributor. Additionally, the effort a distributor must display to effectively manipulate an individual to use without testing when testing is widely available and free, is much more easily constructed to build a prosecution under the traditional theories of felony murder, as this demonstrates more clearly their intent. This legislation serves as both an effort to promote consumer safety and to respond at attempts at legislation like Kristen's Law. Kristen's Law was an attempt at community safety by the Attorney General's office, an attempt that would seek to attribute broad causality in the event of an untimely demise as a result from overdose. Imposing incredibly harsh penalties upon highly stigmatized populations cannot possibly have a positive impact. While laws like this have good intention, it is impossible to enact increased criminalization without shattering the vital protections of the Good Samaritan Act. Instead, promoting consumer safety, giving them the tools to engage in consumption with informed consent, removes the opportunity from the crime. Strengthening the positive interpersonal relationships between first responders and our affected communities is absolutely critical in addressing this crisis. Giving our law enforcement and emergency medical professionals additional tools to engage with the public to help keep them safe. To do so through an expansion of the Good Samaritan Law, through positive community relations, through empowerment of the oppressed, and through law enforcement assisted diversion are practices which will bring this crisis grinding to a halt. These tools, which we will give to our frontline professionals, will open new dialogue, help vulnerable people to feel safe having conversations, and allow for law enforcement to have new tools to keep our community safe that don't require handcuffs or incarceration. While these tools have their use, they are not the most effective tools to address a public health crisis. In this capacity, we would seek to mobilize our frontline in a new kind of role, that of the compassionate protector. For far too long, we have received response from our finest professionals that they tire of feeling powerless to make a difference in this crisis. This very important effort will also empower our frontline professionals to engage our community members on a different level that embraces where they are. These very important tools are critical to give to our professionals to aid in delivering the most effective services to our community. In recent study at Brown School of Public Health, Brandon Marshall, an epidemiologist with over a decade of study on this particular health crisis, has examined the effectiveness of test strips as a tool for prevention and loss mitigation. In this recent Rhode Island-based research study, 92% of participants displayed an interest in being able to ascertain the presence of fentanyl prior to consumption. 87% of those who participated returned for their second visit, which is often a challenge we find with people engaging in recovery efforts, especially our most vulnerable populations. Additionally, there was also a significant connection to additional harm mitigation behavior when a positive test result was received. 65% of people who used the strips reported using less substance. That's a significant change. 59% reported using with another person, which is strongly connected to an increase in safe use and mitigating the loss of life from overdose. And 65% reported using more slowly. All of these changes in behavior have been closely linked to an increase in public safety and loss mitigation. Engaging our professionals in this way will open an opportunity for a wide net of engagement to be created and to increase access to necessary supports and services. This is critical if we are to be supportive of the experiences of this incredibly vulnerable population. Just as we place speed bumps in our residential neighborhoods to keep the person from speeding down them recklessly at 80 miles an hour, we also have to support those who are struggling with substance use disorder by empowering them through education and testing. Together, we can accomplish all of our goals in ways which are more affirming and sensible. Let us keep our communities safe, one strip at a time.